left off. The New Jersey Center for Tourette Syndrome and Associated Disorders, NJCTS, and its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation of or opinion made by any member, physician, nor do we advocate any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thank you, Kelly. And I'd like to welcome everyone to tonight's webinar on family dynamics, parenting a child with TS and co-occurring disorders. It is with great pleasure that I introduce you all to our presenter this evening, Dr. Robert Zambrano. Dr. Zambrano received his Bachelor's of Science degree from East Stroudsburg University in Pennsylvania and his Master's of Psychology and Doctorate of Clinical Psychology from the Graduate School of Applied and Professional Psychology at Rutgers University. Dr. Zambrano is a clinician at the NJCTS-funded Tourette Syndrome Practicum at Rutgers Piscataway campus. He is also in private practice at Stress and Anxiety Services of New Jersey in East Brunswick. He specializes in working with children and adults with Tourette syndrome, OCD, depression, and other anxiety disorders. He is also certified to work with patients who have been diagnosed with trichotillomania and other body-focused repetitive behaviors by the Trichotillomania Learning Center. Dr. Zambrano gives presentations to educators and other professionals across the state on behalf of NJCTS. Dr. Zambrano, welcome, and I'll now turn tonight's presentation over to you.
Thank you, Marty, and trichotillomania is always a mouthful to say.
Well, thank you very much.
Before I get started, I just wanted to point out a few things. First of all, you might notice, all of you viewing out there in internet land, that the first slide says, parenting a child with TS and co-occurring disorders, dealing with problem behaviors, which is probably, I believe, not the original title. I just sort of forgot to change that over to the more positive family dynamic title. So I apologize for that. However, let's face it, if you guys are looking at this webinar tonight, you're probably looking to find out about how to deal with problem behaviors. So before I move forward, I do want to credit the sources that that I'm using for this presentation. And I believe that this PowerPoint presentation is being made available, if I'm not mistaken, to the people viewing this evening. And so the last slide on this PowerPoint that you will see will reference 3 different authors. One is Dr. Kasdan, the second is Dr. Barkley, and the third is Dr. Ross Green. All 3 of those methods, all 3 of them, I will be reviewing what methods they use in helping work with children. One more thing, I am aware that some of the people on this webinar this evening are families that I've worked with in the past, and I do want to assure people that as I proceed through this presentation and do use certain case examples, that I have done my best to try and alter some of the stories, but I'm sure some of these cases are going to sound familiar. A lot of the things that I'm going to talk about, I'm sure, are issues that many of the families that are listening tonight have dealt with. And so if anything sounds familiar, I do assure you it is just a coincidence. Okay, so moving on to the next slide. Okay, and let me see if I can move this off my screen, because I don't know if people can see. Hopefully people can't see the whole.
No, they can't see your screen.
Okay, sorry about that, everybody. There's something on my screen that I wasn't sure if other people could see.
You can slide it if it's in your way.
Let's see.
The little arrow pointing to the right.
There we go. I think I got it out of my way. Oh, that one. Sorry, folks. A little technical glitch here. Okay. Oh, so starting. Challenges to disciplining children with Tourette syndrome. What we find, as most of you probably know, is that children with Tourette syndrome tend to have attention deficit hyperactivity disorder, poor impulse control, difficulty dealing with frustration. They also very often have co-occurring disorders such as obsessive compulsive disorder, different mood disorders, sensory integration issues, a whole host of disorders. And so we do, as therapists, acknowledge and recognize that the child with TS who is struggling with issues has a little bit extra going on. This is not just the case of somebody who is poorly disciplined, who has a bad attitude, which you often hear frustrated parents say about their kids. But there's a whole lot going on that contributes to this, and we want to be empathic about that. We want to understand that. But we also want to make sure that because of those issues, that our children don't become an object of pity. Very often in working with parents, sometimes what might be good standard discipline practices get pushed off to the side because they feel sorry for the children and all the struggles that they're going through. Parents sometimes fear their child's reactions as well, which is another reason why sometimes discipline doesn't get delivered as effectively as it should, in that a child will tantrum. A child will be destructive. A child will disrupt the house in a very upsetting way. And so this leads to parents backing off. These factors lead to inconsistent parenting. What I think is really important for parents and families to be aware of is that children with Tourette syndrome don't need less discipline. They don't need more strict discipline. What they need is a more effective form of discipline. And so hopefully this presentation this evening will give you a few tools to apply towards that. I'm going to start with the Kasdan method by Dr. Alan Kasdan. There's a few basic components to the Kasdan method. And I'm going to use a case example that, again, compiles from other cases that I've worked with. But with the Kasdan method, let's go over the basics. First, we want to know the triggers for a tantrum. We want to know the triggers for poor behavior and plan for it in advance. We want to try and find the positive opposite of that behavior, and I'll explain that in a moment. We want to go for positive reinforcement. We want to have reinforced practice. We want to work towards shaping a behavior and extinguishing other behaviors. So step by step, what I mean by that is, let's take an example, a common one. Let's say mom or dad are trying to prepare dinner, and your child is attention-seeking. Let's say they have something that they want to ask you. Perhaps because of OCD, they have a reassurance-seeking question that they want you to follow up with. But perhaps because it's OCD, they'll ask you the question over and over and over again. And so sometimes, because cooking requires some measure of focus, and the focus is not on the child, you'll see sort of a tantrum-like behavior. Let's say they want something. They want the parent to engage in some kind of activity with them. And so let's say if cooking time is a predictable trigger, what we want to always do is look for what triggers are predictable. We want to know and plan for them. So in this instance, if cooking time is a trigger for inappropriate behavior, we want to plan for that in advance. What does that mean? We want to, first of all, define the behavior that we want to see increase. That's what we want to focus on. We focus less on behaviors we want to decrease, but instead find the positive opposite. So for example, if in this scenario, the behavior that is a concern is disruptive behavior during cooking time or dinner time, the positive opposite would be that during cooking time, the child be able to engage in appropriate behavior. And we want to define that. That might mean going to a different room for 5 minutes and reading a book, engaging in something that is distracting or pleasurable during that time. So again, we want to find outcomes that where we can reinforce positive behaviors. We want to focus on what is appropriate rather than focus our energies on what is inappropriate. Positive reinforcement, this is simple. The whole idea of once a child engages in the behavior that in the positive opposite behavior, we want to reinforce that as often as possible. We want to find some sort of tangible, some sort of meaningful reward for the child that they can work towards. I'm a big fan of token economy. So the idea that if you engage in a certain behavior that is desired, you can earn points towards something that you want. Reinforced practice, I think, is a concept that very often gets overlooked. In fact, what I find is sometimes when I explain reinforced practice to families, they sort of nod and understand it and yet rarely do it. The idea behind reinforced practice is that we don't want to take for granted that the child simply knows how to behave appropriately. And so we want to identify the behavior that we'd like to see and help them practice it. So sticking with the scenario of the cooking time example, perhaps after a session, after meeting with a family, I would tell them to go home and prior to cooking time sort of act out what the family wants to see happen. So mom or dad could go in the kitchen and pretend that they're chopping up carrots or getting out the pots and pans. And then you have the child sort of act out the behavior that we want the child to engage in. So the child might go sit on the couch and watch TV. The child might go play a video game during cooking time. The child might read a book or start working on homework while mom and dad are doing the activity that they want some peace and quiet during. So again, the idea behind reinforced practice is literally acting out all the roles of what everybody's going to play and what everybody's going to do. And you even at the end of the reinforced practice say, oh, you did a really good job. That's exactly what I'd like to see this time. And I think you should reinforce. You should provide positive reinforcement for willingly participating in the reinforced practice. So again, the idea is we can't take for granted that our children know exactly what to do and how to do it. So we sometimes literally have to show them step by step how this process works and then reward them for it. Now, by shaping, what we mean is having realistic expectations for change. The idea is that we are slowly moving the child towards the desired behavior. So, for example, we can't expect a child to go from disruptive during cooking time to completely quiet, hands on their lap, sitting in the lotus position, meditating in the background. What we want instead is to sort of have realistic expectations. So the shaping might literally be just during cooking time, can you wait 2 minutes before coming in and asking a question? Can you wait 2 minutes if there's something bothering you? Can you wait 2 minutes? And you might even provide the child with a timer. I'm a big fan of giving my clients those little timers that you can wind up and turn. And then when the thing goes bing, you can walk into the room and ask mom and dad whatever it is you want to ask, or try and get whatever kind of attention that you're seeking. And then they can provide that attention, but also give you positive reinforcement for successfully achieving that goal. And of course, the idea is that then we move the child little by little more towards the goal of what we want to see happen. So in this instance, sticking with this example, 2 minutes of quiet time becomes 3, becomes 5, becomes 10, et cetera, et cetera. Okay. So, and the concept of extinction is an important one as well, but often a really difficult one for parents to engage in. The idea behind extinction is that we don't want to focus a whole lot on negative behaviors. We don't want to give children attention during tantrums, during difficult episodes. And so the idea behind that is that very often an attention-seeking behavior, very often a tantrum, is an attempt to get your attention. It's an attempt to engage you in a process that you don't want to be engaged in. If you as a parent want to show that you do have authority, that you're in charge of the situation, the last thing you want to do is sort of engage in this tantrum process. You want to make it very clear that I'm not interacting with this. I'm not going to be a part of this. What's difficult is parents have a hard time watching it. And I think that there's almost this instinct that I'm supposed to put out the fire right away, and that if I don't, I'm not being a good parent. However, in the instance of a child with Tourette's who has these kind of behavioral problems, who has impulse control issues, who struggles with emotional regulation, you want to actually allow yourself to step back and sort of ride out the storm. Because if from what I've heard from working with a lot of parents and what I've seen is any attempt to sort of intervene during the tantrum is usually unsuccessful anyway and just adds fuel to the fire. The idea here is saying that I am not going to allow your tantrum to shape my behavior or to change my process of disciplining if I'm disciplining appropriately. Okay, so moving on to the next slide. A lot of parents are focused on punishment, and so I'm not a believer in not punishing, but I am a believer in sort of punishing appropriately. So one of the things that we want to do is before punishing, we want to ask, is the behavior really a problem? One example I think of is let's say the child who has a certain bedtime, and mom or dad are insistent that 9 o'clock is when you go to bed. And on a nightly basis, the child fights. I don't want to go to bed at 9. I'm not tired yet. Why are you always bossing me around? And what ends up happening is 9 o'clock rolls around, and there's a 30-minute to 1 hour fight over what bedtime is anyhow. And so the parent's stated goal of getting to bed by 9 o'clock is never accomplished, and then there's a whole lot of fighting involved anyhow. I think back to a case I worked with a while back where a particular parent was very invested in this idea of having the child go to bed to 9, and then we reviewed how long the fights last. And I said, what do you think would happen if we gave the child some say in this process? Okay, what time do you think is reasonable to go to bed? And the child was actually pretty reasonable. He said, well, I want to stay up till 9:30. And so we asked what was mom's concern, and she said, well, I'm afraid he's going to be really tired and not function very well at school, and his tics will be worse. And we took a spirit of let's experiment and see what actually happens, because they never actually did let him kind of stay up till 9:30 if he wanted to. Although, as I mentioned earlier, he was very often staying up till 9:30, but because he was fighting with mom and dad for half an hour and probably lying in bed being pretty angry for a while. And what we found is once that mom and dad chose to be flexible with this particular issue, he was going to bed at 9:30. I can't guarantee he was asleep by 9:30, but nonetheless, a lot of the fights subsided, and all they had to do was give up half an hour. So again, we have to ask, is the behavior really a problem? In this case, the behavior not going to bed at 9 o'clock. This child was able to get to bed at 9:30 and pretty successfully still managed going to school. Still, there wasn't any major change or decline in functioning at school. Okay, moving on. A punishment must be something that you can enforce and follow through on. I think this is really important in that a lot of times, especially when there's a dramatically bad behavior, according to the parents, there's this instinct to say you're grounded for a month, or you can't play Xbox until the end of the semester. And what I find is parents almost never follow through with that punishment, for that threat. In fact, what I find is also that they've sort of denied themselves something that they can use to help shape a child's behavior. I'm a big proponent, and of course so is Kasdan, of short-term punishment. So typically punishment shouldn't be longer than 24 hours, but it should be something that's impactful, so some kind of loss of privileges. So the idea of being grounded sometimes isn't as impactful as, well, you don't get to use your cell phone for the day. And if you see how often kids are texting and using cell phones these days, that can be a pretty powerful punishment. That can be something that carries a lot more weight than, well, you have to stay home, where guess what? That's where your computer, your phone, your video games, and your television live. And so the idea of taking away something that really matters to the child, but for a time-limited period of time. Okay, so if for some reason something more than short-term is required, then a range to the privileges can be re-earned. So let's say if there is a behavior that is somewhat extreme and the parent truly feels the need to enact some sort of punishment that lasts more than 24 hours, for a week, let's say. The idea is to to use that punishment, but also the idea is to give the child an opportunity to earn back time. So you have lost a certain privilege for this long. However, if you engage in the positive behaviors that we spoke about earlier, the positive opposite behaviors, perhaps you can earn it back sooner. I'm a big proponent of also not punishing when you're angry. As a parent, you can always wait. You can always sort of use the punishment early, a little bit later. And actually what I like about that idea is that it also kind of lets the kid sit for a little while and think about what's happened and what's going to happen. I remember as a kid myself, sometimes the worst part was when my mom said, wait till your dad gets home. And so you can use that as well. You can say, okay, we're going to think about this and we'll get back to you as to what the punishment is. So don't be afraid to wait, because I think sometimes bad decisions and ineffective punishment and parenting happen in the heat of anger. Next slide. Now we're going to move on to the Barkley method, and I'm going to try and zip through this a little bit more quickly. Create positive one-on-one time with children. I think this is one that parents very often overlook as well. They sort of take it as just a throwaway. But I think this is really important. I think a lot of times kids with Tourette's and kids with behavioral problems, their interactions with their families become very much about negative things. They become very much about fighting and frustration. And so I think it's important for the child, not just through words, but through actions, to see that they're still valued and that mom and dad still enjoy their company and still like hanging out with them and having fun with them. So I think it's really important that positive one-on-one time be created for the child, so, again, so that not all the interactions are negative ones. Okay, moving on. Managing behavior more effectively. What we mean by this is setting up clear and consistent demands, focusing on what to do rather than what not to do. If commands don't work, then problem solve and alter. So a clear and consistent demand might be, for example, not just clean your room, but clean your room by this time, and you might even have to define what clean means. Pick up the clothes off of the floor. This could be for a couple of reasons. For a resistant child, they're looking for any kind of loophole to not engage in the behavior appropriately. But perhaps also we take for granted that sometimes a child has the same definition of clean your room that you do. And so if you have a specific demand, you have to give a command that illustrates all the points you're looking to have accomplished. I want you to clean your room by 8 p.m. and I want all the clothes off the floor and put in the hamper and the bed made. If that's your definition of clean, then there can be no wiggle room about that. There can be no confusion about that. I've really found very often that that sometimes the fight between mom, dad, and child is the idea that the parents assume that the child knew what they meant, and the child says they didn't. And then we get into a whole dynamic of, are you lying, are you being manipulative, or did you really not get it? Best to just go around that whole problem, and parents work on giving effective commands. one command at a time. Obviously, this is important for children in particular who have ADHD. So you don't want to throw a whole, I want you to take out the garbage, go clean your room, go walk the dog, and then after that, take off your shoes and put them in the closet. A child with ADHD might still be trying to absorb the first command before you've completed the fourth. Make sure that you have their attention when giving commands. Again, we don't want to take for granted that the child really heard you. So you may need to sort of step in front of them, make eye contact, have them repeat what they said back to you. Don't say it to the back of their head while they're playing a video game, because they might even nod and repeat what you said, but there's no guarantee that they really absorbed what's going on. So when you give a command, make sure if they're in the middle of something, tell them to pause the game. If you have a DVR, pause the show, put the mute button on, or if you like, you can wait till the commercial to tell the child what you want to tell them as well. Immediate reinforcement for positive behavior. So obviously if they engage in the behavior that you want to see increase, as soon as possible you want to have some sort of reward, some sort of reinforcer. And again, my preference is for token economy, some sort of point system. Focus on one behavior at a time to change. So very often when families and children come to me, there's certainly more than one behavior that families are concerned about. My suggestion is always start with some of the small ones. So focus on one at a time, which can be difficult because I know a lot of times moms and dads want the biggest, baddest problem to be dealt with right away. But I think it's important for children and families to experience this model as a successful one so that everybody can invest more. And of course, everybody always says be consistent, and that is very true. So we have to stick with this model. Contracts and point systems. Privileges and rewards should be earned. Rights should be upheld. So what we mean by that is that that we want children to understand that that they can earn things that they want by engaging in the behaviors that we want. Now, what can be difficult with this is very often I work with children who have a hard time coming up with what rewards would be meaningful to them, and the reason being is I ask them, well, what about being able to earn a video game? Well, mom and dad buy me video games whenever I want to. What about being able to have extra video game time? Well, I'm allowed to play as much as I want to. How about if you could stay up a little later? Well, my parents don't give me a bedtime. So the idea is for this kind of system to work, children do need some sort of limits. And so this can be difficult at first because a child who comes to me without limits, I know I've got my work set out for me. But I think it's important for parents to set certain reasonable limits, but then with the idea of you can earn more time, you can earn more of the privilege with positive behaviors. Now, what I mean by rights should be upheld is that certainly we can't deny people food, shelter, clothing. Basic rights like that should not be a part of the point system. So if you don't clean your room, you can't have dinner, is not usually the best way to go about this kind of model. And of course, we want to write up the contract so that it's clear and concise and so that everybody has the ability to refer back to it when necessary. And I think it's good to have people sign it as well so that there's more buy-in. Barclay's feelings on punishment. We should define what rules are non-negotiable and fit punishment to the crime. That one's an obvious one. Let me just move on. Grounding equals no privilege for a certain amount of time. So he focuses less on grounding as a physical, you must stay in a certain place, and more on a certain privilege being revoked. Which I think is consistent with Kasten. Grounding, he also talks about the fact that grounding doesn't work well for older teens for a number of reasons. One, it's hard to enforce, and two, again, there's lots of outlets to the outside world within the home. So that's why I think the model calls for privileges rather than groundings. Unified fronts are important. Obviously, very often when I work with parents, there's one that's the tough one, there's one that's the laid-back one, and then, of course, the tough one ends up having to do all the work. And the child can get very good at using the laid-back one to split the tough one, and so it becomes an ugly model. So half the work is really getting the parents on the same page to agree what are our priorities, what are the rules. And I'm a big fan of having parents write down what are the rules, what are the non-negotiables, what are things that we will punish for, what are things that we want to see improve. And I think it's important that moms and dads get on the same page with that before they really embark in any of these plans. And obviously open communication between school and family is important. We want to manage our expectations as well. So this kind of reflects the shaping thing that we talked about earlier, the idea that we can't expect our children to go from poorly behaved to perfectly behaved within a few weeks' time. It's a process that takes work and consistency. Have a crisis plan. What that means is, again, if a child is using a tantrum as a means of getting out of appropriate behavior, as a means of disrupting the family, at times I've worked with people that the crisis goes as far as threatening to harm other people. threatening to harm themselves, grabbing knives and wielding them towards other people. In that circumstance, we're not talking about negotiating. We're not talking about using any of these things. We're talking about going into a crisis plan. So that means getting everyone to safety, and if need be, calling for help. That might involve calling 911 as well, which again, parents never are a big fan of the idea, but it might be necessary to keep everybody safe. And for certain children, they do reach a boiling point where they lose the ability to reason and sort of control their behavior. And so if you feel that your child can reach that point, it's important to have the plan in place and hope that you never have to use it. Okay. The final method of this evening that we'll be talking about is Ross Greene's collaborative problem solving. Dr. Greene assumes that children don't choose to be bad, they just don't know how to be good due to a lack of certain skills. He emphasizes identifying those missing skills and helping the child to problem solve ways to deal with them more effectively. He focuses again on identifying triggers and planning accordingly. So I think all the models put a lot of emphasis on this as well. And very often one of the things I work with parents is that I help them see is that they very often will tell me that, oh, these rage attacks, these tantrums come from out of nowhere. They come from out of the blue. And I think when we actually analyze it and we talk about it, it turns out if we look not that hard, we can find that actually they're quite predictable. It might be things like interrupting their routine, asking them to do something that they're not interested in doing. If OCD happens to be the issue, then it's important for a family to have a really clear understanding of what the child's OCD is. And so that takes a lot of communication between parent and child as well to understand what are the triggers for OCD, what are the triggers for anything that causes upset for the child, and planning accordingly. Greene's model also looks at helping all parties be heard and clarifying communication between child and parents. So this is an important one as well. I very often work with very frustrated parents who have plenty of right to be frustrated at some of their children's behaviors, but I think sometimes because of their frustration, they might have a tendency to look at their child in a negative light, and there's a lot of times where a parent might interpret a behavior that would otherwise be not a big deal, and they see it as, oh, well, he's being disobedient, he's willfully trying to get under my nerves, get under my skin, get on my nerves, and sometimes it's the child has no intention to do any of those things. And so I think it's important that there be a lot of communication between everybody, there be understanding of motivations for people, and for parents to sort of be cautious of not to jumping to the conclusion that the child's behavior is directed at them or intended to make them angry. In a nutshell, collaborative problem solving involves identifying the difference between 3 different methods of dealing with issues. And Ross Greene refers to them as Plan A, B, and C. Plan A would be giving an inflexible command. So that would be the parent saying, you must do this, no questions asked, I will not discuss this with you any further. And usually the result is a tantrum. Plan C would be the parent saying, well, I don't want to ask him or her to do this. I'm not going to push on this issue because I know that they're going to tantrum, so I'm just going to give in and let the child do what they want. Obviously, Plan A and C are the non-desirable plan. And so Ross Greene's aim is for us to work on Plan B, which is problem solving together. In Plan B, that's the only scenario where both parties get something, but not everything. However, in Plan A and Plan C guarantee that somebody is frustrated, upset, and doesn't get, somebody gets nothing out of the process. So we want to sort of help the family and the child engage in committing to Plan B so that they can problem solve together. Collaborative problem solving operates under the principle that nobody really wants conflict. And I think that's, again, an important thing to note, that a lot of families and a lot of children in these families are struggling with a lot of anger issues, with a lot of frustration, and it's really easy at times to sort of fall into the trap of thinking that the child just wants to be oppositional, that the child is just trying to get under your skin, where quite often what it is the child is ineffective at communicating their needs. They're ineffective at getting the help that they want, expressing themselves. And so we want to operate under the principle that nobody really wants the fight, but we acknowledge that there's certain behaviors are causing the fight. And so the idea is to get everybody to communicate together, to work to problem solve. So an example I can think of is somebody I used to work with who would come to my sessions, and initially it would be very hard to work with him. He would be distracted, he would be cranky, he would complain a lot, he'd get up and stomp out of the room, and the first few sessions it was very hard, difficult to work with him. And so at some point Mom would express her frustration, and he's always like this, and this is why he's so hard to deal with, and he's just so frustrating. And she, of course, was at her wit's end and would say this in front of the child. And eventually what we discovered was he was just really hungry. And so we asked him, well, how come you didn't communicate that? And he said, well, because I told Mom in the car, and Mom said we have to be here in time. And it just so happened that our sessions were right after school, and so they had to leave school, get in the car, and come straight to my office. And so one of the things that we worked on was, can we find a time that's later in the day that works? I had that availability, and so we talked about that. Can we plan, knowing that hunger is a trigger for inappropriate behavior for the child, can we plan for the child to have a snack available? Can we plan for can we allow him to eat when he's in the office, which of course I did. But I think initially what was happening was one of two things. The child would tantrum when he wouldn't eat, and Mom would simply say, I don't care if you're tantruming, we're going to the session anyway. And she would drive straight to my office with a child who was in meltdown mode and not ready to work because Plan A was the only thing that was used. On other occasions, the family would not show up to a session because Mom would call me and say, well, my son was tantruming so much that I had to take him to a restaurant, and we ate there. And so that would be an example of Plan C, just simply giving in. And so once we got better at problem solving, can I say it was a perfect solution that every time it worked out neatly? No. Sometimes we had to iron out some of the bumps in the plan. But essentially, it did work out very effectively, and we had much more productive sessions. What I should have also mentioned is that we put the ball in the child's court, and we said, how do you want to solve this problem? I said to him, well, Mom's issue is that she wants to get here in time. She doesn't like being late. And your issue is that you're really hungry and you can't focus and get emotional and upset when you're hungry. And so he problem solved. Well, couldn't Mom pack me a sandwich and I could eat it in the car? And Mom even said that she was going to work on being a little bit more flexible in terms of, if I happen to forget the sandwich, it's really okay if I stop off at the 7-Eleven, buy a bag of chips, and be 5 minutes late. So this was a situation where Mom needed to work on her flexibility as well. So problem B was effective in this circumstance. Okay, and hold on. Oh, there we go. Okay, so just to summarize before we get to the question portion is dealing with anger preemptively. So we want to identify triggers and plan around them, help a child identify early signs of anger. We want to empower a child to ask for a timeout. This is a concept that I like a lot, and sometimes I even have families hold cards with them. They take cards, just like in a soccer match where you can pull out a yellow card or a red card. I sometimes have families pull out a card so that if they're too angry to even request help, or if they're in the middle of a fight or a fight is about to begin, you pull out a card, and that card is a sign that everybody needs to ask for a timeout and go their separate ways. And I found for a lot of families that I've worked with, that's been a helpful thing. Teach them to use relaxation. So in session, we do some breathing techniques, some muscle relaxation kind of things. And this, of course, is something that helps before the anger builds. So we want to help the child sort of learn the signs of anger in their body and use the things preemptively to prevent them from going into full-blown tantrum mode. Don't expect or demand that your child will choose to use any of these techniques, but reward them if they do. So sometimes, again, when some children escalate from annoyed to rage really quickly. And so after the fact, we want to sort of emphasize, okay, what are we going to do? How are we going to handle this next time? But I don't think we should punish them for not using these techniques. But if they do, we should reward them. Dealing with anger in the moment. Delay the conversation. Be flexible. But it should eventually be returned to. So again, a lot of times in the heat of the moment when a child is angry, a parent gets really fixated and stuck on the idea of, well, he shouldn't be angry. He's not being reasonable. I want to reason with him. But that's not the time to do it. You can do it afterwards. In fact, very often in the midst of an anger episode, you can add fuel to the fire by trying to solve it right then and there when the child is not in thinking mode. They're in raging mode. As I mentioned earlier, get the child and others to a safe place if necessary, and stay out of the way until the tantrum is over if possible. And again, deal with the consequences after the fact. So since we keep talking about after the fact we want to encourage problem solving. We want to come back together and say, okay, what happened? We acknowledge that nobody liked that tantrum, that nobody was happy with the outcome, and so let's see if we can do some collaborative problem solving to fix the situation, to come out with a better outcome next time. Encourage the child to come with solutions. Do not punish for tantrums unless it led to harm or other property. And again, this is one that parents very often have a difficult time with, in that certainly I can understand that a tantrum is disruptive, it's inappropriate, it's embarrassing, it triggers a lot of discomfort in a family. But the idea is that, the tantrum is a symptom of something. And so as much as we can, we ignore it, and then after the fact and before the fact, we deal with it so that we can hopefully prevent the tantrums. We can give them tools so that the tantrums are less likely to happen. And of course, reward instances where the child uses the steps that we've outlined. Which method should I use with my child? Well, all three. And I think they blend together really nicely, although they're three separate methods. We want to give our children opportunities to be successful. We want to give our children tools and motivation to do better. However, and I think this is an important component, I think consequences are necessary as well, in that people often don't engage in a negotiation. People don't problem solve together if they have learned that they can get their way via tantruming. And so I think it's important for parents, when they do pick what are the non-negotiables, to really be firm and strong and say, I'm not giving in on this particular issue, and there will be consequences for inappropriate behavior. But I think it's important for a family to define what are the behaviors they're not going to give in on, what are the things that they can let slide. Okay, and I believe that's it. So as I mentioned earlier, you can look to these references for more information on the three methods that I presented this evening. And with that, that concludes the formal part of this presentation.
Doctor, thank you very much. We have a bunch of questions, so I'm going to dive right in, okay?
Okay.
This question, I'm assuming here that this comes, that it relates to a child with TS and not an adult, okay? Can you discuss the effects of TS and OCD in the marital relationship, specifically regarding irritability and intolerance? So again, I'm thinking it's how do mom and dad handle the irritability and intolerance, but with the child, but I'm not quite sure.
Well, certainly what I could see, and one of the things I mentioned earlier about the whole idea of a unified front, is I've definitely seen how, because of the TS and OCD, which we all know tend to come together, very often these children can be very frustrating, and they can have an effect on the marriage of the parents. We can have an effect on their ability to be an effective team. And so I think a number of things can happen. I think very often when I work with families who have a lot of frustration, I make it a point to give mom and dad some airtime where they meet alone with me and with the child not in the room so that they can vent. They can talk about how frustrated they are and how difficult this is. But I think with each other, they as much as I talked earlier about making positive one-on-one time with the child, I think families need to sort of, because they're so often in crisis mode, they forget that as a husband and wife, you have to create positive time for each other as well, that you have to take care of each other. You have to do a little bit more discussing and negotiating on the parenting than you might perhaps normally do. And so I think this is why it's so important for mom and dad to get on the same page, for them to discuss what are the rules going to be, what are the non-negotiables, and before they start enforcing any behavior plan, that has to be very clear. It should be written down. It should be explained to everybody that these are our expectations. Because I think what can often cause a rift between a husband and wife are the fact that they haven't agreed on what their expectations are. And it might be, I very often see that one parent is a lot stricter or more anxious about their child's behavior, and the other one is laid back. But perhaps the laid back one sometimes has something to contribute as well. They can be the one who's better at letting the non-important things slide. And so I think a team can give each other perspective as to what's important and what's not. So I hope that's somewhat answering the question in terms of how a child with TS and OCD can affect the marital relationship. I think, again, the biggest impact is sort of the stress that it causes in the relationship, in particular when there's disagreement as to how discipline should be conducted and who's going to be doing the disciplining. I think it needs to, as much as possible, be a team effort that's agreed upon.
Well, it's pretty clear that raising kids, regardless of what you've got going on, can cause stress. So in any marriage. So when you add the complication here, it makes it even more difficult, and the adults need to be on the same page.
Absolutely.
Okay. Have you looked at the possible connection between mother-father polymorphisms and TS, OCD, PANDAS, etc.?
Interesting question. I wish I knew what polymorphisms mean.
Okay. Well, I feel a lot better too because I wasn't sure either.
Okay, so
but that's a question we certainly can post for you for later, and if you could get to it, then that would be great. Okay.
It might be a term from a theoretical orientation that I'm not familiar with, so I apologize for not being able to help out with that one.
No problem. parent is asking, how do I know what is and what is not TS when you've got some behaviors going on?
I mean, that's always the $1,000 question that's really difficult. I think in terms of discipline, it doesn't always 100%. Well, no, let me revise that. Let me take a step back and think about this. I think the best approach is actually to ask the child, what's going on, what was the motivation behind that behavior, but to do it without the child feeling like they're being accused or that they're in trouble. That's one of the things that with a recent client that I was working with, the parent would get upset at a certain ticking behavior that the child would engage in, and the parent felt, well, this is an expression of his anger, and he only does this when he's angry. And to the child's credit, he said, well, so what? I'm allowed to be angry, and the tick part is something that I can't help. In particular, this child would punch whatever surface would happen to be nearby. So if he hit a wall, if he hit a desk, and what he would explain in session was that that part is the tick. That when he's angry, but he acknowledges, when I'm angry, that tick comes out. That I feel like almost this need to reach out and tap something really hard to the point where it'll shake and make a noise. And so I think in that situation, what I emphasize for the parents to do is to focus more on sort of how identifying what was the trigger of the anger rather than the actual behavior afterwards. So not focusing on the punching of something, but okay, what happened there? Was that just a tick, or was it, because sometimes ticks can come from random, so the idea was that a tick that was caused by you being upset about something, or was that a tick that just came out of nowhere? And if it was you're upset about something, then can we work on it? Is there something I can do to help you?
But all of this, of course, needs to occur when the kid is calmed down and able to articulate whatever it was that they were experiencing as well.
Absolutely. I mean, and it's tricky in that, is it possible that a child could use TS as an excuse, that they can engage in inappropriate behavior and then afterwards say it was a tick? Sure, it's entirely possible, but again, I want to focus less on sort of the outward behavior and more on sort of identifying the trigger and dealing with that effectively after the fact.
Okay. Should discipline for the child with TS differ from discipline to a sibling without TS? Excellent
question. I think at the core of it, no. I think the same behavior should get the same consequence, for example. And I think when we talk about deciding what are the non-negotiables, what are the rules in the house, they should apply to everybody. And if there's going to be a consequence enacted, then it's the same consequence for everybody. So if Joe, who has Tourette's, has some sort of destructive behavior, and his punishment is that he loses Xbox privileges for the night, then Tina, who doesn't have Tourette's, if she does the same exact behavior, should have, I believe, the same exact consequence. I think the difference is that a child with Tourette's perhaps needs that disciplining for everybody, not just for him, but the home's discipline should be more consistent and more effective. So the traditional methods of, just punishing and getting results don't always work as well. So I've had families come in and say, well, when I do this with the one child, he snaps right into shape and he behaves himself, but when I do it with the other child who has TS, it's not quite effective. And so the idea is to find what is effective for the child. So let's say if we're talking about a consequence, for example, we should make sure that if we have a clear understanding of what the rule is, and if the rule is broken, this is what happens. But for each child, perhaps what's important will be different. So Joe might not care at all that if he loses Xbox because he's not a big Xbox player anyhow. But the idea is that there should be something that he or she can lose that matters to him or her. Okay.
Would you comment on techniques for discipline for students as it relates to in-school behaviors?
Sure. Again, and I think that's the tricky gray area where we have to sort of figure out what is a tick and what is not. And so I very often advocate for as much as possible that if there's a tick behavior, we accommodate, we ignore. So if someone is making noises, if someone has a motor tick, then that certainly is not something I think there should be a consequence for. But perhaps there should be a reward for effective use of intervention tools. So, for example, if you have a child who has really loud ticks during a certain portion of a class, I don't think they should be punished for that, but perhaps they can also be rewarded for appropriately using interventions like stepping out into the hallway if that's something that they're somewhat resistant to. But let's say if a child with TS has a tantrum in the school setting, and maybe the tantrum is because of an OCD thing, or maybe because they're frustrated with their tics, I think actually, and I don't know how controversial this will be, I hope it's not, but I think the consequence should be the same, in that what I often tell children and families is that it's not your fault that you have Tourette's, and that we empathize with the struggles that you have with Tourette's, but at the end of the day, you are responsible for your behaviors. And so if you engage in some sort of destructive or inappropriate behavior, and it's clearly not a tic, it's just sort of you being frustrated and acting out, it doesn't really matter if it's, you know, that you have low frustration tolerance and other people don't. I think sometimes even consequences can be appropriate motivators for dealing with an issue, for saying, okay, this when I engage in this behavior, something not so good happens to me, and so I really do need to work on this and work to change this.
Okay, fair enough. I have a question from a mom with a 6-year-old who does not yet know or understand that he has TS and OCD. How and when do we explain these things?
Good question. 6-year-old doesn't know he has Tourette's or OCD. I think, honestly, as soon as possible. In that, what I find is the older the child gets, the harder it is for them to be accepting of the disorder. I think the harder it is for them to also explain to their peers. And I think that's one of the reasons why you want the child to be aware of it early on. Because first of all, they might not have an understanding of what's going on. It might be a scary thing for them. They, you know, in the vacuum of knowledge, very often kids can come up with a lot scarier explanations than just you have a neurological disorder that makes you do these things and you can't quite control them. So we want to take that into account as well, that, you know, in the absence of fact, kids kind of fill in with wild imagination.
They make it up, yep.
So I think that's an important factor. But I think the other factor is the idea that the kids around them are also wondering the same things. And if they don't know what's going on, they're going to imagine some scary stuff and perhaps start to ostracize the child, treat them differently. And I think the earlier the better that people around the child can be educated as to what's going on, the more we can normalize this and say, okay, this isn't the child acting out and trying to be attention-seeking, or this isn't the child trying to be weird. The idea is that everybody understands that this is just something that the child can't help. And what I find is very often the tics become background noise once people understand what's going on. But of course, it's hard to explain to other people. You don't want to. I certainly would not advise that you go to a child's class or his peers and explain what Tourette syndrome is, of course, without having told the child that they have Tourette's and what Tourette syndrome is. This is a common question, though. A lot of parents are really concerned about having their child have the label. And so I can certainly understand the discomfort with it, but I think there's probably more good than negative that comes out of explaining to the child what TS is. And as a plug for the New Jersey Center for Tourette Syndrome, there's I know that they have a lot of publications and comic books and things that are age appropriate for young children to help them understand what's going on.
Well, I think the worst thing is the kids that they make up stuff. They think they're going to die, or it's contagious or whatever. So I think the sooner you clean that up, it seems to me it just eliminates some of that stress component for them as well. I have a question about approaches for children with trichotillomania, or the question is that a whole other webinar?
Well, it definitely could be a whole other webinar. In that, you know, habit reversal is a component of helping people deal with trichotillomania. The trichotillomania.
Maybe you want to define that for people that
are
not familiar with it.
Yeah, there's that tricky word we keep bumping up against. Trichotillomania is classified as a repetitive body focused repetitive disorder. And what it is a disorder where people continually pull out hairs from different parts of their body. Most commonly, it's from the head, eyebrows, and eyelashes, but really any part of the body where hair can grow from, a person with trichotillomania will start to pull to the point where there can be pronounced bald patches, even scarring. And so with trichotillomania, there is no sort of easy answer to how to treat it. Again, I won't. That could be a future webinar, I suppose. But essentially, with that, you want to find out all the dynamics. And again, the triggers. Triggers are kind of the key word this evening. What are the triggers of the pulling behavior? And then depending on what triggers we identify, we might use techniques like habit reversal training, or if it's about anxiety, anxiety reduction, relaxation kind of stuff. If it's about an environment triggering the hair pulling, then we focus on altering the environment in some way. So I think there's no kind of easy answers as to how to deal with the trick. I think what you need is before you even start to treat the trick, you have to have a very thorough assessment of what the triggers are, and because it's very idiosyncratic from person to person.
Okay, thanks.
No problem.
Have a question about a lot of the questions, and the program has been geared to younger kids.
Yes.
I have a question from an adult with TS, and we're asking about what would be better ways to communicate with older children. How can parents co-journey with their older children and manage their tics?
Okay. I think the idea of that one-on-one time thing is something that we often think is just something for younger children, but I think it's maybe even more important with teenagers as they reach a stage in their life where they're distancing themselves from their parents. There is less and less positive family together time, and so as corny as it might sound, I think you create fun time together, but you also sort of hopefully are setting the stage for a more open sort of approaching adult relationship where we sort of talk about what are your concerns, how can we help you, rather than sort of the model of that we are angry at you and we are going to forcibly shape you into some direction. The older the child gets, the more we want to sort of express what our concerns are without the whole "I'm your parent and I told you so" kind of model, but sort of engage them in conversation and show the young adult that we do respect their opinions and that we want to understand what's going on with them so that we can help them, rather than your behavior is irritating and upsetting to me and I want to change it. And so I think there's even more of a call. The older you get, there's even more of a need for a collaborative method of dealing with problems.
Okay.
And it starts with just sort of, again, creating a lot more positive time between parent and child so that all the interactions are not focused on, you're doing this and it's getting on my nerves. So I think we can't overlook that.
All right. How do you teach a child to generalize the problem solving after a therapy session? And the example is that, the child learns to self-soothe in therapy and problem solve, but he doesn't follow through at home. It becomes a real issue at home, and asking the child to apply the methods that were learned in a session.
Right. I would refer back to that slide where we talked about reinforced practice, and again, a lot of times it sounds like kind of a corny, weird thing to do, but to anticipate, to say, to sit with a child and say, these tantrums are happening often, and we've identified what the triggers are, but at the end of the day, you're having trouble using them. Can we just role play? Can we act it out? Let's pretend that this is happening again, and what would you want me to say? What would you like to say? So act out all the roles. So I think that's one way to sort of make that more likely to happen, is to just, find some way to reward them for doing it when it's not in the heat of that really intense moment, but when things are calm. And as much as possible, you kind of make it a fun, silly thing if you can. But with the idea of we are practicing something that we plan to have you use in the future. What I would say is, again, I'm not a big fan of giving people punishment for not using the techniques. However, by and large, what happens is when they don't use the techniques, they tantrum. They engage in behaviors that are inappropriate. They end up getting some sort of consequence that they don't like. And so after the fact, we sort of explain that, look, I don't enjoy punishing. I don't want to punish. I don't enjoy seeing you in so much discomfort, so can we revisit this? Can we get back to using some of this stuff that we've done in therapy that we know works? So yeah, hopefully that's a helpful answer.
All right. I have a 15-year-old boy.
Okay.
He's unable to, when he gets frustrated, he's unable to kind of unravel how he got there. How can, the parent work with him to understand how the frustration occurred so that in the moment, and then plan for the future so that, and again, that's part of the problem solving.
Sure, good question. I think initially, especially when there's no clear answer to what's going on, maybe you keep a journal. Maybe you write down, okay, what time did this happen? What was I doing just beforehand? Was there something I saw? Was there something I heard? Was there something I was about to do? And you might have to keep the journal for several days at a time, because what might happen is you keep some sort of pattern establishes. Well, I tend to tantrum just before I was about to start homework, or I tend to tantrum when mom is making a certain kind of noise, or when she picks up the phone and maybe she talks louder than she normally would, and that makes me uncomfortable. So finding the triggers really is important, I think, and so journaling when we're somewhat clueless as to what the trigger might be could be an effective intervention.
Okay, thanks. My daughter has moderate OCD, and
Okay.
one of her triggers is perfume.
Mm.
She typically will have a tantrum, which can be quite severe. They do time out, and so she can cool down, but no matter how much exposure there's been to therapy, it doesn't seem to solve it, and looking for some suggestions here.
Interesting one. I wonder if it's also more of a sensory integration issue, in which case I would say then don't wear strong perfumes around the house. You might have to sort of take one for the team.
Yeah, but you're so exposed to them everywhere you go too. It didn't define here whether this happens like outside the home. You go through the wrong department at Macy's kind of
Right.
situation.
I mean, I think even there, you sort of when you go to a shopping center, you try and anticipate what's the wrong department to go to, and don't go through there if we're finding that exposure isn't really helpful. But let's say if you happen to be walking on the street past somebody who happens to be wearing the wrong kind of perfume, and that sort of causes a tantrum. I'm guessing that's the question.
Probably, yes, more so than at home, I would think.
Okay. What I would say is, again, the child is not responsible for the fact that they have OCD or a sensory integration issue, and this is upsetting. What they are responsible for is sort of trying to do something to change their behavior. And so what I do know is that if it is, let's say if it's an OCD thing, a tantrum is typically not a part of a compulsion. It's a response to frustration. And so the child should be responsible for saying, okay, can I get myself away from the perfume if I start to smell it? So if I anticipated earlier, can I step away? Can I do some relaxation techniques to calm myself down to get myself through this so that I don't tantrum and do something destructive? So I think this is a difficult one, but certainly we try as much as we can to sort of limit contact to the trigger of the tantrum. But then after as you said.
I'm sorry.
Well, as you said, Marty, I mean, it's impossible to completely avoid something like perfume on a day-to-day basis.
I wonder if you could substitute that for, I don't know, chew gum. Do something that's going to fill your nose with some other kind of aroma almost instantly.
Sure. I mean, without knowing this particular child, we'd have to try all kinds of things. Yeah. And just keep trying different things until you find something that works. But the idea still is that that you're responsible for controlling the tantrum.
Okay, fair enough. This is from an adult with TS, and Tourette impacts so many areas in a family's life. How can parents be better prepared to work with their children to understand the tics, and be better prepared to work through in other situations in life?
Right. I hate to keep going back to the same suggestion, but I think the best thing is to be as informed as possible about what is the trigger for some sort of difficult moment, for something that will cause a disruption in daily routine, and as much as we can plan around that. Certainly, I think any parent who's watching these webinars, I mean, it's a wonderful series. I think the more we can educate ourselves, the better. I think the better we can take care of ourselves as parents is the more you can sort of do self-care, give yourself a break when needed, do some relaxation stuff relaxing stuff for fun with just mom and dad away from the house. The more you sort of can feed your soul, the easier it will be to deal with what are some really frustrating real-life issues. And I think that's something that very often gets overlooked is self-care.
Okay, thanks. How does one know whether the discipline issues in defiance go beyond some of the strategies and would require a medication intervention?
I'm sorry, Marty, can you repeat that?
Sure. How would a parent know when discipline issues in defiance go beyond what the strategies can handle, and that you would then potentially be looking for a medication intervention.
Okay.
Where do you say we can't? This isn't working, and we'll try something else?
I mean, typically with children with TS, I as a therapist advocate for a combination of the two. You know, I certainly would respect a parent's desire to not use medication, but I found that more often you get better results when somebody is properly medicated. So I you know, sort of err on the side of using it earlier on than later in any intervention. But I also think it's important that you're constantly doing an analysis of how it is that you're applying discipline. Have you been consistent? Have you been clear with the expectations? Have you used techniques that we've talked about? And so to continue to try and refine the process as well, to sort of not give up on the idea that discipline can be effective and that it can work, but perhaps we can get more effective in using discipline.
Okay. We have a few more questions I'd like to try and get to, but if anyone has to leave the webinar a little early, I would just like to remind you that there will be a survey that pops up on your screen, and if you just take a minute to fill that out, we really appreciate it. I have a question about the contracts. When a contract is made, should there be an end date in which the contract is reviewed to see if it's still valid and prevent the possibility of it kind of fizzling out and becoming ineffective? Do you work that into the beginning?
Very good question. Yeah, I think the contract, I refer to it as a living document. And so what that means is, let's say if the contract should really focus on one behavior, at least initially at the beginning of the process of contract writing. It should focus on a behavior that we think that that we're likely to have some success in. And so because we're likely to have success in, then we can revisit the contract and say, okay, it seems like we've got this under control. And so our focus in terms of the contract should also talk about sort of if you engage in this behavior, you get X number of points, and then the points can be cashed in towards this sort of reward. But let's say if the behavior ceases to be an issue, it should still be a rule, but perhaps then the contract shifts away from talking about rewards and punishments for that sort of behavior and says, okay, what's next on the list? What's the next item up the hierarchy of things that we want to address and hopefully modify? So let's say if the initial if the initial easy behavior in the contract has been addressed effectively, the rule stays, but then the whole point system gets geared to whatever is next on the contract. So I always recommend that contracts be typed out in like a Word document, something that you can go back and revise and change easily. Because certainly you do want to keep you want the contract to also list out what the prizes are, and the prizes should be updated at times as well, because children might earn certain things that are one-time only offers. What I also explain to parents is, initially the contract is going to change a lot in that we have to get a feel for how easily children earn points, because we don't want our kids earning an Xbox game once a week. So we might have to make adjustments on the fly initially as well in terms of how easily points are earned and how many points a certain item is worth.
So you're working it on points then?
I mean, that's part of the contract is to say, okay, this is the behavior we want to work on. We want to see, the idea is the positive opposite. So let's say if we want you to, if in the past a child would tantrum when asked to clean their room, then the positive opposite might be, we want you to, on Tuesday nights from 7 to 7:30, pick up the clothes on your floor, put it in the hamper, and do your bed. Obviously it's on a case-by-case basis. And then if you do so, you earn X number of points. And then the next page might say, okay, what are the items I want to earn and how many points are they worth? But let's say if the child gets consistent at doing their bed, if it becomes a behavior that no longer really needs to be addressed for therapy, we move on to something else. Now let's say if once we remove the point system, they stop doing the things they were initially doing, then we go back to using points.
All right, fair enough. I think this will be our last one. OCD is a common co-occurring disorder,
yes,
and punishment can become self-abusive behavior in some TS teens. How can a child like that be handled without causing self-destructive behavior?
Okay, so repeat the question one more time.
Right. OCD is a common co-occurring disorder, and punishment can become self-abusive behavior. In teens, how can a child like that be handled without causing self-destructive behavior?
Okay, so I'm assuming, because I'm a little confused by the question, punishment as in the compulsion is to do harm to oneself?
Well, it could be. I'm having a little trouble with the question, too, now that I'm reading it again. But I guess the point is that whatever the, how can it be handled without causing self-destructive behavior? I guess if you're trying to work with these techniques, but you don't want them to become self-destructive behavior.
Sure. Well, I mean, I guess the model I'm thinking of is, sometimes you work with children. Most who have TS have OCD. That if you're working on exposure and response prevention as a means of trying to deal with the OCD more effectively, that exposure and response prevention can be a very frustration-inducing process. And then as a result, the child will tantrum and engage in inappropriate behaviors. And in that circumstance, I would say that, and I think I mentioned this in the presentation, I don't so much want to focus on punishing for a tantrum. Now, if the behavior gets destructive, if the behavior gets violent, then I do think there should be consequences for that. But if a child or a teen has a tantrum, if they get upset, if they curse, if they express frustration in an inappropriate way that's not destructive or dangerous, then I think we let it slide. Because what can sometimes happen is the parents and the parents will back off on having their children do effective treatment, on having them do effective exposure and response prevention, because they fear the tantrum.
Okay.
And so, I certainly, as somebody who works with OCD a lot, I can empathize with how difficult the process is. I can empathize with, working with Tourette's, that, when you're doing exposure and response prevention, the frustration can cause more tics to come out. But nonetheless, in the long run, I think it's an effective approach in that, if we stick with it, the OCD symptoms get weaker, and thus, all that stuff that's causing so much frustration and angst in somebody's life, if we can reduce that, then in the long run, perhaps we see also a reduction in tics and improvement in quality of life.
Thank you, Doctor. Thank you very much. I am going to say good evening to you, and Kelly is going to pick up with some final comments that need to be made to the audience. So good night, and thank you.
Thank you.
Thanks for joining our webinar on family dynamics and parenting TS children. There is an exit survey which should show on your screen as you exit. Fill out the evaluation. This helps us with our funding and being able to show our effectiveness. The discussion board will be open. It's open now and is available for you to post on for the next 7 days on the NJCTS website. That website is www.njcts.org. We will also be archiving a recording of tonight's webinar to be posted on the website in the next couple of days. Our next presentation, Current Treatments of TS, will be presented by Dr. Roger Kurlan and is scheduled for Wednesday, March 17th. This ends tonight's webinar. Thank you, Dr. Zambrano, for your presentation, and thanks everyone for attending. Good night.